Hi, my name is Mary. I'm going to be your nurse practitioner today. Is that okay that we record you for this video?
Sure.
Okay. Let me just wash my hands here. You doing okay?
Yeah.
Okay, we're doing a pregnancy assessment today. So the first thing we're going to do is weigh you. If you just step on the scale for me. Okay, thank you. And I'm going to just check your height here. About 62 centimeters. Okay. And if you could just take a seat. So looking at her general appearance here, she looks healthy, she looks nourished, emotionally looks okay right now. So we're going to do your vital signs. I'm going to put this under your tongue here while I take a blood pressure. It's going to feel tight. Okay? Perfect. Check your heart rate. Okay, very good. Now I'm going to move on to your face. Just examining your face here, looking for symmetry. Hair looks thick. It's not breaking. Eyes. Let me just take off your glasses. Looking for any jaundice. Nose looks good. It's even. Ears looking for discharge. Any tenderness?
No.
And I'm going to look at your teeth, smile, and your gums. Everything looks pink and moist. No plaque noted. Okay. I'm going to go ahead down to your thyroid. No masses. Okay. Now moving down to your thorax and your lungs. Your respiratory rate, when I was checking your pulse, everything looks regular and symmetrical. So I'm just going to do a little tapping here. Okay, and I'm going to take a listen. I'm going to ask you to take some deep breaths. Listen to your heart, so just breathe normally. I'm going to palpate for apical impulse here. Okay, good. So the next step would be the breast examination, but for her comfort, we're going to defer this. But what we would do is we would inspect for symmetry, color, of course, any tenderness of the nipples and the breast, and of course we would do I would palpate for any masses in your breast, any lumps, anything like that. And then the last thing I would do was compress the nipples. Okay, so the main part of this exam is going to be your abdomen. So if you just lay down for me. So I'm gonna just first looking for any scars. This is your first pregnancy?
Yeah.
Okay, and you're about 12 weeks.
Yes.
So no scarring. Everything looks even here. I'm gonna palpate. And your baby, you're not going to feel your baby move until about 16 to 25 weeks. So you're only 12 weeks, so you're not going to be feeling your baby move at this point.
Okay.
So your fundal height, I'm going to feel for, it's going to be, yeah, it's about 2 inches above your pubic bone here. So that's good. So now I'm going to listen for your fetal heart tones. I'm going to use Doppler for this. So I'm going to put a little jelly, and we're going to listen for your baby's heartbeat. I'm just paying attention to how fast the baby's heartbeat is beating, the location of your baby. Okay, and then the next step of this assessment would be your genitalia, but we're going to defer this just for your comfort. So we would look at external genitalia. I would palpate, of course, for any tenderness or cysts. Internal genitalia, I would inspect your cervix, which is all the way inside. I would check for color and shape of your cervix. At this point, we would do a pap smear if necessary, but you've already had your pap smear, so you're good with that. I would check your vaginal walls for color and any discharge, any unusual discharge, any smells. I would do bimanual exam, which is your cervix, uterus, and checking for the tone of your pelvic floor. And the next step would be your anus. So we're going to defer that as well, but what we would do is check for any hemorrhoids, any bleeding, check your rectum and your rectal vaginal septum for any unusual shapes, tenderness. So you can sit up at this point. I'm going to check your extremities now. Checking for any edema, any varicose veins. So when you're pregnant, you can swell, mainly in your ankles. So I'm just going to check your legs here. So your ankles look good, no swelling. No varicose veins, which you can also get because of the weight. So next we're going to do, I'm going to check your reflexes, okay? So if you could just relax. And I'm going to compare your other side here. Are you okay?
Yeah. That tickles.
I'm going to check your ankle reflex here. Comparing it to the other side. Got the giggles. Very, very good. Okay. Okay, so the next thing would be Leipolds maneuver, but that is not necessary for you because you are only 12 weeks.
Okay.
But what Leipolds maneuver would be doing was checking the location of your baby. So once your belly gets bigger, we can manipulate the belly to feel location. If he's breech, if the baby's breech, he or she, if they're longitudinal, so pretty much they'll lie where they're lying.
Okay.
The general size of the baby, just by feeling, you can feel their head compared to their legs and arms, and you compare to their back. So that will allow you to feel the general size of the baby, and we'll be able to feel your fundus.
Okay.
So it's going to be high up, which is that hard ball. And the last thing for the Leipolds maneuver would be if the baby has dropped into your pelvis yet. So you're still a long ways away, but so far you're looking good.
Okay.
Thank you.
Thank you.